Hello everyone. I'm very grateful to see all of you come out tonight for an educational seminar. I hope you will learn something today that will help you. First, I would like to thank Dr. Michaela Carlson for providing this opportunity. Today, I'll be speaking on preventing, managing and treating type 2 diabetes with the healthy lifestyle choices. I'm Dilshad Begum Mohammed, a graduate student in applied nutrition from University of New England, expecting to complete my graduation in fall 2021. I have my MD in alternative and complementary medicine and medical systems. I have my bachelor's in business management. Apart from these all, I have several nutrition and healthcare certifications. I am nutrition and health blogger. I educate clients about the benefits of proper nutrition and lifestyle changes. I create content for YouTube videos. I write factual nutrition information from peer-reviewed research articles for health and wellness blogs. Now let's look into presentation outline. I'm trying to brief that what I'm going to present in the seminar. First, I'll touch with the target population. I'm going to explain in target population why this particular population is targeted for this seminar. Then background, prevalence of type 2 diabetes. Key goals and learning objectives. Like at the end of the seminar, what are you going to learn? Then what is type 2 diabetes? Who gets this? Risk factors, symptoms and complications. Later we'll look into available screening and diagnosis. Later I'll take you through what's the connection between type 2 diabetes and diets. Then diabetes being a self-management disease, how we can manage with the help of nutrition, physical activity, medication and lifestyle medications. Then what is the available treatment and ongoing care. Later, I'll take you through the simple tips that are required to prevent, manage and treat type 2 diabetes with diet and healthy lifestyle choices. And then I'll conclude. Now, let's look into the target population. Studies indicate that Western dietary habits of middle-aged adults can increase the risk of type 2 diabetes. That means especially these Western dietary habits of middle-aged people are one of the causes for developing the type 2 diabetes. Some of occupational factors are also shown to be associated with the development of type 2 diabetes. Now let's look into those factors. What are these occupational factors? Sedentary work. Most of corporate employees are having desk jobs. Schedules that have shift work, yeah, insufficient time to rest between the shifts. Because of global work time schedules, definitely we are not having time and you all might not be finding the time in between the shifts. Then schedules that don't allow a person's time to participate in physical activities. You might want to have some physical activities but might not be able to do that because you might have your client pressure and you might be continuously coding. You might not go home early to go for your gym. Then difficulty taking medication or eating regularly, probably because of your busy work schedule, you're missing your meals, you're skipping your taking medications on time. Availability of healthy food choices. Obviously, we might not have time. You all guys might be not finding any time to cook food in home, might be going for processed food, yeah, outside food. These are not really good and these might be reasons for developing type 2 diabetes. Now let's look into background. Almost 34 million Americans have diabetes. That means about 1 in 10 and around 90 to 95% of them have type 2 diabetes. Isn't it shocking? As per the predictions of a study, type 2 diabetes will continue to rise and more than 75% of the people from developing countries who falls under 45 to 64 will be turning into diabetic. This is more scary, I know. Type 2 diabetes and its consequences are enforcing massive health burdens worldwide, and there have been no effective measures to cope with this disease fully. But we can manage. So let's go and look how we can do that. Before learning about type 2 diabetes and how it can be managed, First, let's look into learning objectives. I'm sure by end of this seminar, you all will be able to discuss diet control plan, identify the importance of physical activity and lifestyle modifications, discover the strategies to prevent, delay and treat diabetes and related complications, and will be able to evaluate how to improve health through balanced nutrition. Now, let's get into knowing more about type 2 diabetes and how it can be managed. Wow, isn't it very yummy slide? Lot of food, loads of food, right? So what happens after eating? After eating, most of the food turns into glucose. We also call sugar, the body's primary source of energy. Definitely we need energy, for that we are eating food. So now what happens next? First, we should know, like in people without diabetes, glucose stays in healthy range because insulin is released at the right time and in right amounts. Who is this insulin? This insulin is who helps glucose enter into the cells. Before knowing more about the insulin, let's first know the normal blood glucose ranges. Before meals, less than 100 milligrams per deciliter is a normal range. That means you don't have diabetes. After eating your meals of 2 hours, it should be less than 140 milligrams per deciliter. So if you're having these numbers, that means you're safe and you don't have any kind of diabetes. So now we understood that these are the normal blood glucose levels. Then what insulin does, and who is this insulin? Let us know more about that. What is type 2 diabetes? To understand that, we should understand first insulin. Insulin is a hormone secreted by beta cells present in the pancreas. We all know the body organ pancreas. Beta cells are there and they secrete the insulin. Insulin is required by the body in order to use sugars. That means whatever we eat, food which got converted into sugars. Insulin takes the sugar from blood into the cell. Individuals who are having type 2 diabetes do not produce enough insulin, nothing but insulin deficiency, or have the body cells that cannot use insulin properly, which is called insulin resistance, which I'm going to explain in the next slide. So, because of these two conditions, type 2 diabetes will develop. So what happens? Insulin is not enough. So the glucose builds up in the blood instead of going into the cell. It can cause severe problems. In short term, your cells may be starved for energy. In time, high blood glucose may hurt your eyes, kidneys, nerves, or heart. I hope you all understood. It's very important that we should understand this process. Now let's look into insulin resistance. What's this picture? Don't worry, I'm going to simplify it. So type 2 diabetes begins with insulin resistance. That means first insulin resistance will be developed, and after few years you will develop the type 2 diabetes. So how it will happen? It's when the cells in your muscles, fat and liver don't respond well to insulin and can't take easily glucose from your blood. As a result, the body needs more insulin to push the glucose enter into the cell. At first, pancreas thinks, oh, let me go and meet the demand, and it will try to secrete and produce more insulin. But over a time, the pancreas can't make enough insulin. Because of this, the glucose levels in the blood will increase, which I explain in the other slide. Who gets type 2 diabetes? Type 2 diabetes can occur at any age, including childhood. However, it frequently occurs in middle-aged or older adults. If people who are middle-aged, having the family history of diabetes, are overweight, they have the more chances to develop type 2 diabetes. And it's more common in some ethnicities, which include African American, Hispanic or Latinos, American Indian, yeah, Asian Americans. Now let's look into what causes. What are the other causes apart from this? So the main causes are divided into two: non-modifiable risk factors and modifiable risk factors. So if we look into non-modifiable risk factors first, family history of diabetes, which I explained, we can't modify this. Then Age over 45 years. Can you stop aging? No. Then race or particular ethnicity, can you change this? No. Then history of gestational diabetes. Some women during the pregnancy develop gestational diabetes. So in future, they might be having more chances of developing type 2 diabetes. So they need to be a little careful. Then let's look into modifiable risk factors. Physical inactivity, could be desk jobs, or you might not be having time, anything. So this is the one of the causes. So we can change this. Then high body fat or body weight, overweight or obese, high blood pressure. If you're even having high blood pressure, you need to be careful, and high cholesterol levels. Apart from this, insulin resistance, which I already explained. Extra belly fat. Yeah, obviously extra belly fat is linked to insulin resistant. The moment you're insulin resistant, we will be getting type 2 diabetes. Next, lifestyle factors, which I already explained. So I hope you're very much clear with the non-modifiable risk factors and modifiable risk factors. Now let's get into symptoms of the type 2 diabetes. These symptoms are like increased thirst and urination, like you will be going to restroom several times, increased hunger, you'll be just jumping on foods, fatigue, blurred vision, numbness or tingling in the feet or hands. And you need to keep in mind, sores that do not heal, means here sores won't heal easily. Then unexplained weight loss. What are the major complications of type 2 diabetes? The complications of type 2 diabetes are severe, which can damage body systems such as kidneys, eyes, the heart, and vascular system more generally. Apart from this, even brain. It can damage the brain, and you might get some cardiovascular diseases, which can include transient ischemic attack, cognitive impairments, etc. Here it is showing neuropathy. That means probably this is like this is because of hyperglycemia. That means higher blood glucose levels. They damage nerves in the peripheral system, nervous system. This may result in the pain and numbness. Feet wounds may go undetected, get infected, and lead to gangrene. And these are the things which you need to keep in mind. If any of these body parts, your systems are getting damaged, means your physician would be knowing this, and he'll be helping you with particular tests to be ordered. So you don't need to worry much, but need to make sure that these are the parts which are going to be attacked if you are if you developed already the type 2 diabetes. Next, what are the screenings and diagnosis? Tests for screening and diagnosis of type 2 diabetes are very much readily available. So we don't need to worry. If many of you, anybody are here who are already diabetic, you might be knowing all these tests, and if who did not develop yet, lucky, you know, I hope you won't be developing. So let's look into that. So these are the tests which are available. You can get you can Google for all these, but try to Google information which provide factual health information, and just try to check all the time when you're checking .org or .gov to take the information. So the first test is FGT, fasting plasma glucose test. For this you need to fast for overnight and blood is drawn in the morning. Then HbA1c, this test tells the average blood sugar levels for 2 to 3 months. OGTT, this test is done. First blood will be done after fasting. Then you will be given some sugary drinks for every 2 hours. Then again blood is drawn. That's how this test goes on. RPG, so random plasma glucose test. It's in the name. Randomly you can go anytime for this test. Next, fructosamine. This is not widely used test. This I'm going to explain it to you in the next slide. So these are the ranges. You can Google it. The ranges varies little, but almost they'll be the same. You can keep this all the time handy whenever you're checking. So A1C, usually these are the levels for pre-diabetes. If it falls under 5.7 to 6.4, if you're diabetic, it should be less than, if you're diabetic, there'll be more than 6.5. So all the time make sure that they should be less than 6.5. FPG, so like it should be less than all the time 126 milligrams per deciliter. OGTT should be less than 200. RPG should be less than 200. So if they are more than 200, that means you are diabetic. Now, here we are with the fructosamine test. So this test measures the total amount of fructosamine in the blood. What is fructosamine? It is a compound that is formed when glucose combines with the protein. It is not widely used, maybe needed to monitor a person's average glucose levels over the past 2 to 3 weeks. Also required when A1C tests cannot be reliably used in cases of shortened RBC lifespan, or if you're diagnosed with abnormal hemoglobin levels. In those circumstances, this fructosamine test can be ordered. I hope you're clear. You don't need to know much on this, but just keep it in mind. I can't really have diabetes. I have no symptoms. This is a myth, but the fact is that many people have no symptoms but still they'll be diabetic, because you can have diabetes for many years, which I explained you. First, you will be developing insulin resistance, you would not be knowing, and then you will be developing slowly diabetes without any symptoms. So keep this in mind. Is type 2 diabetes curable? It's big no. It is not considered curable, but there are strategies you can adapt to keep it under control. Remission is possible. What is remission? Remission means that your blood sugar levels are below the diabetes range, usually without you needing to take any diabetes medication. I hope you're clear. Because evidence shows that through substantial weight loss and exercise, you can achieve this remission, means you can keep your blood glucose levels under control. But remission is not considered cure, because when you start putting on weight and stop your exercise, again your sugar levels will be elevated, means increase. So this is not curable, but this can be managed. Let's see how we can do that. Diabetes is a self-management disease. Type 2 diabetes is very complicated and burdensome disease that requires you all, that means individuals with diabetes, to make several daily decisions regarding food, physical activity, lifestyle factors, and medications. I know this is not very easy task. I'm suddenly telling you to change something. That's not possible. But you can slowly do it. You can think to do within 6 months of time. You might plan within 2 months. It's up to you. You should be get motivated and try to do this. Diet plays a crucial role in keeping up blood sugar levels in obese individuals or pre-diabetes and individuals with diabetes symptoms. And type 2 diabetes can be treated with diet and regular physical activities. That means you can manage these. Understanding diabetic complications and having proper knowledge on diets and your attitudes can better control this disease. So now let's look into self-management plan. How should be this plan? You need to plan few things, like you should have a proper meal plan, then activity plan, medications. You should be taking medications on time and should not be skipping them. Blood glucose monitoring, logging and inputting results. You should be aware of how to operate your blood monitoring instruments. Then regular healthcare appointments, and don't miss your lab work. Diabetes related technology, if it's available, try to Google and try to understand if you can implement them. Sick day plan. All corporate employees have many sick day leaves, so let's have the sick day plan. Daily food care, because I explained that diabetes complications and consequences. It can damage other organs and parts also, and it will definitely affect your food, skin, and dental. So you should have all these to be taken care. Now, what can you do to prevent type 2 diabetes. This is simple 3 tips just to keep in mind. If you are obese, try to lose weight 5 and 10% of your body weight if you are overweight, which I told, if you're obese. Eat healthy foods like fruits, vegetables, and whole grains. I'm going to explain about the food in other slides, but make sure that you're eating healthy foods. And start a moderate exercise routine at least 30 minutes most days of a week. These are the simple 3 tips that you can start with. Now, what's the relation between type 2 diabetes and diets? As per the studies, type 2 diabetes is mostly seen in people who consumed oil, flour, and sugar in excessive amounts, high intake of carbohydrates and fats. So these are the foods scientists, studies have seen in people who ate these all. So try to avoid all white foods like white bread, potatoes, and pasta. Diabetes does not just go away, and there is room for all foods in healthy meal plan. You don't need to worry on cutting so many foods. We can add so many foods. I'll explain you how that is. Whole grains are higher in fiber and healthier than processed foods. So instead of processed foods, try to have more foods with the whole grains. Choose fat wisely means eat more monounsaturated fats, polyunsaturated fats, and omega-3 fatty acids. Eat less saturated fats, trans fats, and cholesterol. See, fats are categorized into 4. Monounsaturated fats, polyunsaturated fats, saturated fats, and trans fats. Monounsaturated fats are very good. They lowers your LDL cholesterol. LDL cholesterol is bad for us. And these you can find in avocados, olive oil, sunflower oil, etc. Polyunsaturated fats also same like monounsaturated fats. They reduce the LDL cholesterol, and they have the 2 types of omega fatty acids, omega 3 fatty acids and omega 6 fatty acids. You can find these in salmon, fishes, and all these. Try to Google. Again, I'm telling you, try to take factual nutrition information. Then eat less saturated fats. Saturated fats are very bad. Cheese, lard, and all these, because they increase your LDL cholesterol, which should be reduced. And then trans fat, they are also same like saturated fats, which are not good, which increase the LDL cholesterol. Trans fat means these are the liquid oils turned into solid fat by the process called hydrogenation. So the examples of trans fats are processed food, French fries, cookies, crackers, brownies, no, you can see all these burgers, everything. I know it's very difficult to leave them, but try to cut down. I'm not saying totally eliminate them, but limit them. Now let's look into type 2 diabetes and physical activities. Studies show that walking and having more physical activity could reduce the risk of diabetes and may reduce the initiation and progression of type 2 diabetes and its cardiovascular consequences. Through promising effects on body weight means these activities can reduce your body weight and insulin sensitivity. That means I explained the insulin resistance. If you have insulin resistance, your insulin sensitivity is low. Then glycemic control, controlling your blood sugar levels. Then blood pressure, it can control your blood pressure. Then lipid profile, it can improve your lipid profile. And inflammatory defense systems, that means immune system, it improves immune system. So these all are linked. These many things, this all will lead to stop for the development of type 2 diabetes. So move more. Get at least 30 minutes of physical activity 5 days a week. If you are not active, talk to your healthcare professional about which activities are best. Start slowly to build up your goal. Just don't jump on just today I said so. Of course you got motivated, but start slowly. Now, let's look into type 2 diabetes and lifestyle changes. First, let's discuss about alcohol and smoking. We all know that these 2 habits are not good, but still we enjoy them. But what studies are telling? Smoking and drinking by diabetic patients can further damage the effects of diabetes. Many prospective studies in Europe and Japan showed the positive relationship between smoking habits and risk of developing type 2 diabetes among the middle-aged men. So this is about smoking. If you go for the caffeine, I won't say to cut down on caffeine. Try to drink not more than 4 cups of coffee or caffeine related beverages. Now let's look more deeper into the alcohol in the next slide. Now let's look deeply into the alcohol consumption. Excessive alcohol intake may cause obesity, that means overweight, induce pancreatitis. Let me explain what is pancreatitis. We all know that insulin is secreted by pancreas. So when you take alcohol in more quantities, there will be a chronic inflammation in the pancreas. So when your pancreas is having inflammation, it can't secrete the required insulin. So there is a development for the insulin resistant, which slowly gets into the development of type 2 diabetes. This is how they are related: alcohol, pancreas, and type 2 diabetes. And excessive amount of alcohol can disturb carbohydrate metabolism. Carbohydrate metabolism means our cells need continuous energy. So it would be disturbed by the excessive consumption of alcohol and damage liver function, which most of us knows that. So better stop. I know you all can't stop suddenly. Try to limit. How? Limit alcohol to less than 2 drinks per day. Drinking alcohol is not recommended in certain conditions, like if you have high body fats, I mean triglycerides, have high blood pressure, or have any liver problems, are pregnant or breastfeeding. Try to totally cut down. If you choose to drink, drink with your meal or snack, not on empty stomach. Drink slowly or dilute with water or dash soda. So if you're just but still I'll tell you, try to avoid as much as possible. It's not very easy. This is a sudden behavior change, but at least try to think. How many of you already stopped something, yeah, change your dietary habits after you developing diabetes? Yeah, I can see some hands. That's good to see. Now, should we know about medications? Yeah. Why means in type 2 diabetes, when the initial treatment options fail, that means meal planning, weight loss, and exercise, to control blood glucose levels, the next step is medicine that lowers your blood glucose levels. Here are the common medications which you don't need to know and try to pronounce it. Of course, there are some word hard. See, metformin is a common medication. I just listed them to know that not to worry that we have medications. If nothing works out as a last option, after medication, you would be put on insulin pumps. You would need to take everyday daily insulin. That's the last option what we have. Manage, prevent, treat type 2 diabetes with diet and healthy lifestyle choices. These are the overall tips of the total seminar. I'm just providing you the best tips to be followed. Let's look into that. Eat a well-balanced diet that has no sugars, reduce fat foods, and fresh fruits and vegetables. If you're diabetic, try to cut down sugar. If you're non-diabetic, eat less sugars. If you're diabetic, still want to have some sweetness, try to use artificial sweeteners. Please try to Google them again for factual nutrition information if you're Googling, right? Then eat lean meats means in lean meats fat is removed. Try to have plant-based sources of protein over animal-based protein. Salt should be reduced irrespective of you have blood pressure or not. Eat meals at regular times and must be small meals spaced over the day rather than 1 or 2 big meals, which are helpful. This is if you are diabetic. If you're treated with insulin or certain oral drugs, you must eat regularly to stop hypoglycemia, means low blood sugar levels. To stop this, you need to make sure that you are eating 3 meals a day plus suitable snack, most preferably a fruit. Avoid a high intake of red meat, sweets, and fried foods. Limit processed food. I explain you in the processed food you will have the trans fats which are really not good. They will increase your LDL cholesterol and overall cholesterol. Plan a physical activity that is best for you. Try to have 30 minutes of physical activity on most days of the week. Reduce smoking and alcohol intake. Rather, I say that quit on them. I know this is not very easy because this is a behavior change. How many of you started quitting on something? No hands. I know that's not easy. See, if you did not try to do that, try to think within 3 to 6 months if you can do that. People, if anybody started implementing some diet changes, yeah, I can see some hands. Please continue to that and stick that, because the moment you leave that again, you go back to the same stage. Like all the time behavior changes, goes in stages. You know that we will be progressive, and if you come back and again you will fall and you'll come to number one. So I just expect you people, if anybody started implementing, please continue, stick to that. If no one started, please try to do something new in your life, like start with simple exercises, some movements every day, and while eating, just check cutting down on processed food. Try to cook meals in home. I hope you liked all these tips. Wow, we are in conclusion slide. So what is now? Proper testing, treatment, lifestyle changes, healthy eating as a strategy, promoting walking, exercise, and other physical activities can show beneficial effects on human health and prevention or treatment of type 2 diabetes. You are now on your way to preventing type 2 diabetes. I hope you all liked my presentation. Thank you everyone. You all are fantastic. I really appreciate the patience of you all in listening to my presentation for 30 minutes. I hope I motivated you all enough to bring fewer changes to manage type 2 diabetes. These are the references. That content was created for this presentation. The content is created from peer-reviewed research articles or from the website which they have .gov or org, which I was telling throughout my presentation. Once again, thank you so much for listening to my seminar.